So one of the areas that we have is the depot. And the depot is a place where we take children in when they have to have a painful procedure performed, because we don't like to do those in their bedroom.
And we do that so that their room that they have is their safe place. They know that they can be there and they're not going to have any pokes, they're not going to be having any ouchies. No one's going to attack them, in a sense, in their room.
The depot has a train that's been installed by the ceiling to be a distraction to children when they're laying there and trying to have an IV started or something done. And I found out when we were working on this project that it hadn't worked for 7 years. So engineering happened to be there and was going to patch a spot on the wall. And I said, you know, wouldn't it be really nice if we could get that running? Is there any place in town that works on trains that we might be able to get somebody to work on it? He says, I'll see what I can do. And that's the last I heard. What they did was they took the train down, and when they got down to the office or the shop, they took this carriage apart, and the motor sits inside of there. There was no motor in it. There was nothing in there to make it run. So we pulled some numbers, did some research. But when I started looking for the, bringing up the part numbers, everything was coming back in German. All the websites were in German, so of course that didn't do me any good because I couldn't read German. So, but then found where I could buy it in the US, and then we ordered them from there. They installed them back into this carriage, brought it up, put it back together, and flipped the switch, and it ran. The next time I heard about the train was the day after Angelica Patton went in to start an IV and put an NG tube into a little 2-year-old from Bozeman. And she flipped on the light and the train started running.
He flipped on the switch and it made its first trip around the track, and all of us were like crying, and it was perfect.
And I happened to be walking to the Mansfield Center across the Glass Breezeway by the emergency department. And this mom with her 2-year-old little boy, she had pulled him in a red wagon with his IV pole out there so he could get some sunshine. And he was sleeping in the red wagon on a pillow. And so I said, could I talk to you for a few minutes? And so we started talking about her experience in care. And I said, one of the things I'd like to ask you is there anything that we could do to improve the experience you've had? And she said, well, I'll tell you one thing that you can't do, and you cannot remove that train. And then she told me the story about going with her little boy, knowing that he had to have an IV and an NG tube, and knowing he was going to freak out. And she said when we walked into the room and turned the light on and the train started running, his eyes were just lit up. We work here because we want to, help the patients and make their stay here as best as it can be, and especially children when they have to get a procedure, needles or whatever, that's frightening for them, and I can relate to that with my own children. Having something like this to take their mind off of that and make it just that little bit better for them, you can't buy that. That's kind of what we're about. That's why we do this. It's to help people out.
Thank you. We are so grateful.
We are so thankful for you because you just made us cherish that room so much more and made it so much more special.
And I thank them for providing this kind of service, this level of service, and they do this every day, and I thank them for that. They gave it to us as a gift. And so I consider it probably one of the best experiences I've had since I've worked at St. Vincent's.